to what we're doing. So we're as anxious. There's going to be an announcement fairly soon. I'll just sort of give you a bit, some context. We expect there's going to be an announcement relatively soon that will help us to reach back out to the hair loss community and really bring some clarity to what we're doing. So we're anxious. We've been purposefully quite quiet for now, right?
I can imagine.
We're anxious to come out and bring some clarity again to that, and sort of relieve some people's frustrations and natural questions and skepticism about what we're doing. So,
and this is actually a really interesting interview for you guys, because I'm sure that most of the interviews that you've done have been general news-based organizations, whereas with us, you're reaching out directly to the people that will go into your clinics and say, right, give me hair.
Yeah.
So I've got everyone asking me, what's going on. So they've given me a bunch of questions. So should we just dive right in?
Yeah. So generally, I think we'll let Rolf answer the sort of the clinical and scientific questions, and I'll answer the corporate and commercial ones, and we'll just go back and forth, natural sort of flow.
Yep. So I've got them all in my Google Keep notes here. So I've got like a check mark list. So it's all going to be organized fairly well. Replicel, gotta find Replicel. Okay, Dr. Rolf Hoffman. Okay, so the first question is, a member mentions a recent article claims Shiseido will release a cure in 2018. Can you comment on this? Furthermore, the article states First Medical staff will take some cells to reprogram as induced pluripotent stem cells, the scientific breakthrough that won Shinya Yamanaka the Nobel Prize and a fancy new washing machine back in 2012. At the moment, it seems fibroblasts are the go-to ones for the job. These can be found in joints and scar tissue. That sounds a wee bit painful, but there is already research into alternative methods, such as getting them from urine. Then doctors will remove a piece of your scalp, a few millimeters in diameter and just as deep as your roots. This will yield a small sample of the cells, which triggers hair growth. Is this the method pursued by Shiseido, or is it just the Replicel technology? That's a big one.
I'll answer the Shiseido part of the question, then I'll let Rolf answer the other. But essentially, that whole last part, the whole technical part of that question, is just all dead wrong.
Okay.
Yes. So
completely wrong.
Okay.
So we'll let Rolf explain why. The first part of the question I can answer with respect to Shiseido's statements that they could potentially have a product in 2018. First of all, that's Shiseido's news. That's Shiseido's statement. So I can't speak for them. What I can say is, of course, as I read that news, I know that it's also still dependent on when they start this next phase clinical trial and what the data from that clinical trial reads out as. But certainly, I believe, as a reader of that news, as a consumer of that news, that it's possible, if they get the trial started relatively soon, that they could have data from a trial by 2018, which could, if the data is right, and if Shiseido considers it appropriate, to be on the market in Japan in 2018.
Now, so you guys are going to be starting phase 2 trials shortly, if not already. I'm not. There's a bit of a gray area.
We haven't started the next phase trials yet, and it's difficult to describe it precisely as a phase 2 trial in Japan, because the Japanese regulation of cell therapies doesn't require you to necessarily do the traditional, as we think of in the West, phase 1, phase 2, phase 3. What we do know is this next phase trial, call it what you will, in Japan, being run and funded by Shiseido, could lead to a product on the market. In Japan.
And many of us are already willing to make that sacrifice to fly out to Japan. There's a lot of really desperate people there, not just men, but women also.
No, so it's especially also for women. And to answer one of the scientific questions, Shiseido uses the same technology as we do, because, as you know, they bought a license. So these are not induced pluripotent stem cells. These are the cells we call cup cells.
The dermal sheath cup cells.
The dermal sheath cup cells. So the rest of this question is just wrong. So Shiseido and Replicel is the same technology. right? And they do it in Japan, and we do it in the West.
And the technology is very simple. You can read about it on our website. Very simply in English, it's a single suture biopsy from the back of the patient's head.
Yeah.
We isolate the dermal sheath cup cells from that tissue biopsy, and we simply grow more of them. We don't differentiate them, we don't modify them, we don't induce them to become something else. We take cells, we grow more of those cells, we freeze them in vials and ship them back to the clinic for re-injection.
Okay.
And that's what we do, that's what Shiseido does.
Yeah. And what we need to know is how many injections do we need and how many cells per centimeter square. And this is going to be the job of a phase 2 trial in the West.
Actually, that brings up an interesting point because I was thinking about the injection frequency. Suppose at some point when Replicel becomes commercially available, will patients be allowed to have injections as often as they please, or will there be a maximum frequency regulated by the FDA or someone else?
I think this depends on the jurisdiction you are in. Yeah. So if this product comes to the market, it will be regulated as what according to the trials which have been done before, single or double or triple injections. Yeah. What doctors do in the clinic would be off-label.
Okay.
Right. So that's, I think, common practice. But whether this is something more beneficial than just a single injection, ideally it should be a single one. But we all get older. Maybe we need another injection a year later. But this is future. I don't know. Yes, but the label will be according to the trials we do in a dose-finding way.
Right. So only trials will answer those questions with respect to how many treatments you need to get an aesthetically quote unquote full head of hair. What we believe now, we're interested to see what trials will prove out, is that when we convert a follicle with androgen insensitive dermal sheath cup cells, that conversion of that follicle with that insensitive population will be durative, long-lasting, if not permanent. But when you inject those cells into the scalp, you may not convert every follicle. That may be dependent on where the follicle is in the growth stage. Yeah?
Right.
Okay.
So you might need multiple injections to convert enough follicles to have a quote full end quote head of hair.
Okay.
Yeah.
So,
but again, these answers only trials.
Only trials will give us that answer. Right now, it's a hypothesis.
would you know that by the end of the second phase trials?
This next phase trial will study two things. It will study the clinical difference between a small dose of cells, a medium dose of cells, and a large dose of cells. And it will study also the difference of a single injection versus double, maybe even triple.
Okay.
Yeah, so this will be a pretty complex trial. Okay, so can you imagine the variables, low, medium, and high dose, and single, double, or maybe triple injections? And then this should be a very big trial, and then this should give us the answer you're asking for.
Or it may be a combination of data combined from Shiseido's trial,
Yeah,
which is likely going to be around a single injection, and ours, which could be around multiples, right? So these are the trial design questions that we're answering amongst ourselves right now.
Okay.
So ideally, it would be a low dose of cells with a single injection, but who knows?
Now, when you collect the cells,
Yeah.
The donor cells, I suppose,
Yeah.
and you cultivate them, correct?
Yeah.
Let's say I want to go in for a follow-up treatment.
Yeah.
2 years later. Do I need to go for another collection of them, or will you have them stored somewhere available? Is that
Again,
possible?
regulations would not allow this.
So it would have to be collected every
Yeah.
single time.
For sure. Yeah.
You won't want to record our disagreement, but I'm not sure why you say that. Why can you not? You can store autologous cells.
Well, you can store it, but then it would be off-label of the prescription. Of course, you can do, but this would be a doctor's decision off-label. The label would say it's a single biopsy done in the theater room and injection after freezing, and not because the trials will not be done 2 years later. So this is what I mean.
Yeah.
It's
Okay.
always off-label, but it's so many things are off-label. When you get a prescription of something, whatever, a corticosteroid for the scalp, of course it works on your skin as well, but it's off-label. Yeah.
So there's two elements to the question,
Yeah.
right? Which is why we disagreed, because there's the label, which is what the label that the regulatory agency gives you is for use of this product to treat something in accordance with what your data package
Right.
supports. So if you do a clinical trial and you say we injected patients in two times within 90 days and it gave us this results and it's safe, then the label will be for that.
Yeah.
The doctors, in their discretion as medical doctors, have the ability to use, in almost every regulated country, to use products off-label as they deem fit in their medical discretion. That couldn't be something, though, that because we can only advertise per the label. So we can only, as a company, advertise the product per the label, right? But as Rolf said, products are being used, hundreds of millions of dollars of products are being used every year in ways which are prescribed off-label. So that's common.
And
from a manufacturing perspective, it's totally feasible that we could store multiple doses of a patient's cells
for
ready
years.
for injection in the doctor's discretion.
Right.
But they won't lose their inductivity properties over that period of time, right?
We've stored the cells out for
a year, 1.5, something.
Yeah.
But from other resources, the cells are pretty fit for many years.
We've been storing, we as an industry, as a cell therapy industry, have been storing cryopreserving stem cells and thawing them for re-injection since the late 60s, 70s for sure. And cell populations typically, when cryopreserved under the right conditions, and thawed under the right conditions, their viability is restored very quickly.
Perfect. Okay. So the next question was, what is the status of Replicel's clinical trials? But
this already had
pretty much covered that. So I'll check mark that off. Next question is, when will trials start?
Again, the next phase trial will be in Japan. I think your readers and listeners should watch for an announcement fairly shortly. We think.
Would it be safe to say within a few weeks?
Certainly within the next couple of months.
Okay.
We think at the moment. I can give you an update on that if it changes. This has been a very active discussion with Shiseido, I should say, right? So, maybe your questions will get into why there's been such a delay between phase 1 and 2, but we are working very aggressively now to move into our next phase trial in Germany in 2016. And I know we've been saying that for a long time, so readers will be skeptical, but I get it.
Yeah, well, that goes for pretty much every biotech. There's always unexpected delays, and I'll be honest, a lot of us are quite frustrated with it, and I'm sure it's out of your hands. I'm willing to bet that if you could get through all of them,
if we could do as we would like to do, then the trial would be ready by now. But
So what are the setbacks? Like, a lot of us we don't know what the setbacks are. Can you comment on that?
It all started from a cascade. There was a cascade of events that all started when we completed the phase 1 trial. Cell therapy products are very much the cell product at the end is very much a product of the culture that you grew the cells in. It's a very symbiotic sort of process, the cells and the media that you grow them in. And we were excited about the trial and preparing for the next phase, and the culture media that the team had grown those dermal sheath cup cells in was pulled off the market. And Rolf can maybe give you some color around that because he was there at the time.
I'll put it another way. The manufacturer of our media was bought, and then by General Electric, and then General Electric decided not to make any new or any longer culture media. So
this culture media.
This culture media, or also others, not only us, not only ours, but other. So we had to find another source to make a culture medium, and this is not that easy. So it's not like you have Coca-Cola and you have another manufacturer, we have the same recipe. And so this took us a long while to find a manufacturer to do the culture medium conditions we would like to have them. And this is one of the major reasons for this delay, because you have to do all the validations again and again, and the cells, they need 12 weeks to grow, and you have the result, and you do the next experiment another 12 weeks, and so it's just adds up time. The cells don't grow within a week. They just need.
Yeah. So these experiments, we had to basically go back to the bench and reinvent a culture media that ended up with as close a cell population as we could with the cell population as we used in phase 1. And like Rolf says, every time you do an experiment, it's 12 weeks. So you do an experiment, you learn something. You do another experiment, you learn something. Yeah. You do another experiment, you learn something.
4 experiments per year.
Right.
Wow. Plus the time it takes for the follicle to actually grow and then the hair to grow, which is another typically between 3 to 5 months for the entire hair cycle.
That's why it's fibroblasts are much quicker. But these cells, I call them divas, so they're very difficult to grow. And really, the complete delays, they all started with the shut off of this company who made the culture medium.
And I thought that was there were rumors that you guys had to adjust the process.
Yeah,
and then some people were saying you were making it better.
Well, of course you try, to make it better. And actually, during the last 2 years, I think we made it really better, not by chance, because we had to go back to the bench. Yeah, but on the other hand, you cannot have a completely new culture condition, because then the regulators will say, well, your cells are not the same because you use a different culture condition. Tricky.
Because there's a real risk that if we don't come up with a similar product and we prove that it's very similar, we'd have to go back to phase 1.
Yep.
Exactly.
Right.
And I thought that once you guys were doing everything all over with the new method, I thought, well,
and
doesn't that mean they have to go back to
there's still a risk
to avoid, right?
Yeah, I mean, there's still a risk of that, right? I mean, we will submit our application to the German regulators with all of our data. We will ask for the next phase trial.
Yeah.
But until you have their ruling, you don't know for sure.
Yeah.
And like Rolf says, when we were forced to go back to the bench and we're culturing cells and we're doing all these experiments over a course of 3 years, we learned a lot. So we found opportunities to, like you said, we think make the product even better. The other thing which happens, which you appreciate, is that over the course of those 3 years, the world also changes around you. So the availability of different culture medias and different technologies, even different validations, different assays, all come available to you too. And so now, you're constantly in real-time evaluation. Oh, there's a new technology. Should we be incorporating that?
Yeah. And then you never come to an
incorporating that,
but
right?
then you have to start all over again.
And this you cannot.
From a corporate commercial perspective, there's always this decision. There will inevitably always be more science experiments to be done. And when is the right time to decide which product and which protocol to take into your next phase trial? And those are not easy questions to grapple with and answers to get to sometimes.
And to summarize this, the shut off of this company was completely out of our control. This just happened within 1 week.
Oh wow.
Yeah. And then
you guys must have been frantic then.
Well, smaller.
Kind of.
Smaller things have killed companies.
Yes, killed companies.
Smaller things.
Smaller things.
You guys survived
killed
that.
companies,
that's
right?
impressive.
So, I think we've been accused of a lot of things, in social media and by people who have been following the story, and we have thick skin. But I think the most we can say is we've been over optimistic and perhaps a little naive about how quickly we could solve these problems. And, it's been 3 years, and it's not because we haven't been working hard and throwing every available resource at this. And yes, we have decided as a company to also diversify our product portfolio. So we've not invested 100% of our resources into this challenge. We've also diversified because we thought that it was the right thing for us to do and for our shareholders to diversify our expertise in the cells of the hair follicle into other products, like Rolf alluded to with the fibroblasts that we're now doing clinical trials in dermatology and tendon repair.
My mom might benefit from that. She had a torn ACL and MCL, cartilage shattered, and something else. I can't remember.
Wow.
So
yeah.
She that was in one sitting.
Wow.
She fell on her knee and just.
Wow. Well, we're excited about those products, and now that those trials are going, the dermatology trial is enrolling, the RCT trial, the tendon trial is enrolling, treating patients. Now we can re-energize and refocus on the third of our biologic products, and that's the RCH.
Yeah. Okay. So another question from one of our readers. I have so many. Actually, this one's for me. Do you think that are you aware of Histogen with Dr. Gail Naughton?
Sure.
There's been some speculation that with the dermal sheath cup cells injected into the scalp, it might benefit from Histogen's HSC complex. Is that something that could work in synergy, kind of like finasteride plus minoxidil?
These are hypotheses, and this comes back to what Lee just said. There's always room for scientific thinking, and this is one out of a million possible options. This and this. I personally believe that the cells do their own job. They make their own growth factors, and with the Histogen complex, it would be just a completely different product again. And again, back to phase 1 and so forth. The answer is probably, but we will not check it. What we saw in our animal experiments, they're just so good. So I don't believe that the cells need anything extra.
I guess, from my perspective, I think there's any of a number of things that people are doing now that you can see a short-term hair density response from. And I think of them in very, very simple terms, because I'm not a scientist. I think of them as either invoking a stimulatory response, so, the needling and, lasering, ultrasound, maybe they invoke some kind of immune response, stimulatory response of the cells that are there just to do a little bit more, but it doesn't last all that long, and it doesn't really address the disease. Or what I call the fertilizer approach, right? Which is the PRP, the growth factors, the cytokines, those kinds of things like the Histogen product or PRP, which again I think feed the existing cells to do a little bit more for a short period of time. So one could certainly imagine, and I'm generally a big fan of using cells as companions with existing products, but it becomes very difficult to design clinical trials. You have to do your own clinical trial of those cells and then do a combined trial, maybe, if you think that's, what I would think intuitively makes sense is you could do something that has a short-term effect, and then our cells come in with a longer and more durative long-term effect.
But this could probably phase 4 things.
Yeah.
Fourth phase?
No, phase 4 trials are after
post-marketing trials, right?
Trials,
so once our product gets on the market, you could do companion trials and say,
okay.
But what if you also combine it with this, and what if you also combine it with that?
Histogen could maybe be a good supplement. I think of all the ones that I've seen so far here.
Look,
I have a lot of respect for Gail. I know her well, and they've been involved in this kind of thing for a long time. So.
I would personally go for both. Replicel first, tack on Histogen, see what happens.
Well, see what happens. But again,
if you guys need a guinea
science,
pig, I'll sign up. I don't even need to sign forms. Don't worry about that.
Well,
Okay, but in all seriousness, so when will trials start? That's done. What is the status of Shiseido's clinical trials? More or less in line with yours.
Yeah.
So that's still
Shiseido's will start first.
Oh, okay.
Our every expectation as we sit here today, at the moment, is that Shiseido's trial will start sooner than ours and fairly imminently.
Okay.
But that's Shiseido's news, Shiseido's timeline. That's.
I'll mark that as checked. Another individual mentioned any details on the Shiseido trial, sample size, repeat injections, dosage, but those will be one
I
injection.
think you should
versus
watch for
2 or
some
3.
news on that. Yeah,
Right.
yeah.
Okay, I'll mark that as checked. There was another question here. I recall Mr. Hall, during his interview with Spencer from Ball Truth Talk, stating that...
3 years ago.
Yeah, it's been a while.
It's a while ago, yeah.
That phase 2 would be dosing down less cells, I believe. Was this a poor choice of words, or are they using lower dosage cells/injections? My assumption is that the cells are losing their inductive properties, in which case fewer or more potent may be better.
Can't say what David meant for sure, but what I've always and has always been a matter of discussion as long as I've been here is that we will look in our next phase trial to study different dosage sizes, as Ralph already alluded to, small, medium, and large dosing, because ultimately, for us as a company, the job is to get the most effect with the least amount of product.
To cover the largest area you can think of in the entire scalp.
It would pretty much be like a Norwood 8 if you ever are so unfortunate. I don't think anyone goes beyond that.
Yeah,
I've seen some that are basically that, but it's very rare.
So that's our job. We don't think that there's with these kinds of products, there's not a toxicity wall. We're not, you can't inject enough cells to have toxicity in a local injection like this within reason. But our job is to really find more the minimum threshold, not the maximum threshold.
Okay. Next question is, in the original study with mice, page 1269, I don't expect you to remember that.
Wow. Somebody's done their homework. That's great.
There's a lot of dedicated users.
Well, they know the publications better than we do.
Yeah. I believe it.
Yeah.
They found injecting the cell associated with wounding yielded superior results. Have they considered wounding with humans?
No, we will not. But actually, wounding the injection itself, it's the wound per se.
Yeah, because it is a needle.
It makes no sense. And so the wounding is maybe one part to make the hair, let's say, sensitive to it, but it's also again a hypothesis. Yeah? And I think the wounding theory is kind of a myth. Wounding, it's also needling.
Okay, so it won't be November 30th.
I'm going to have to partially agree. There's been one member that's combined heavy needling to the point where he was bleeding all over his head with minoxidil, but he had pretty good results, better than anyone I've seen with minoxidil alone.
And do you know for how long?
Oh, he's been doing it for about a year.
Oh, so it's something he constantly does, yeah.
And
so he's very passionate about it.
It's very harsh wounding. That whole wounding aspect was pretty much banned to discuss on one of our forums, because it was so violent that we were worried about others mimicking it.
Yeah,
and going too far.
I would think so.
It's like I said, I think that there is things you can do to invoke a stimulatory response, right? That basically, in my very simple understanding, it triggers the existing cells to do a little more than they're otherwise would do. But what it doesn't do is it doesn't stop the progression of the disease.
Yeah, exactly.
So the existing cells are doing a little bit more each time you do that, but every year there's fewer and fewer of those cells to stimulate.
And which is why we're also following a lot of Dr. Kutsarellis' work with wounding itself as well. But I'm pretty sure he combines many other factors. As far as I know, he's trying to put in FGF9 into his protocol with Folica. But we cannot get enough information on how exactly...
I think that's combining, what I was colloquially referring to as the stimulating versus the fertilizing, right? So if you do both, maybe you can also get an ephemeral response. And if you do it all the time, you can get a constant ephemeral response. But it only is increasing density over a decreasing base.
Yeah, and I tried the wounding thing myself too, and it didn't do anything. not much.
And
It was a pain.
I'm quite sure that some people will have hair loss from it.
Hair loss.
Do you think
Because
it could do more damage?
it's with damage and does induce little kind of telogen effluvium. Because usually if you do a hair transplant, you see hair loss in non-transplanted areas just because of the damage.
There is a shock loss.
Yeah, there's like so-called shock loss, right? So wounding. Well, what we intend to do is to develop or to bring to the market a very mild and minimally invasive procedure. So because otherwise it makes for me no really sense if it's so harmful. Because to treat an entire scalp it should not be so painful, right?
Well, the skin is pretty thin too at the same time, and when I was trying the wounding, I was almost in tears. Like, I actually was in tears. I could feel the tears coming out of my.
And can you imagine? Then you must be very passionate. And there are so many passionate people on your website, I guess. But it's in principle, not everybody is so passionate about it.
We've tried a variation of different experimentals as well. RU5841 is a frequent compound we use. It's a THC inhibitor, similar to finasteride, but we use it topically. We've tried even lithium chloride as well. Apparently that supposedly increases CD200 progenitor cells. We've tried going through hypoxia with stamoxidine. We've had one member actually do a whole host of combinations of things. Stamoxidine, sulfasalazine, lithium chloride, UVB burns, some derma rolling. Derminator actually, he uses a derminator, which is much harsher, but it doesn't hurt as much. And he's actually had temple regrowth, believe it or not. And not just vellus hairs, but terminal in bald scalp that he hasn't had any hair in about 10 years.
But at least this shows you that there are still hairs perceptive of our treatment. The hairs are still there, 90% of the miniaturized hair.
We've got another meeting we've got to be at the top of the hour. So
okay, I'll try and wrap this up as quickly as possible.
No problem.
There's only, I think, one or two questions left. Actually, one. The last one is: has Shiseido enhanced or modified the procedure to their knowledge? I believe the use of IPS cells was a mistranslation.
Yeah, it's mistranslation. Okay. No, they use the same technology.
Shiseido is also doing some other work on their own with Harvard, I think, right? But the development of this product is being done very much in consort. So all of our developments we share with Shiseido. All the work Shiseido does on this product, they share with us, because it's very, very important to us from a corporate commercial perspective, I guess also from a clinical perspective, that we are developing the same product for use around the world. Right? The worst case scenario for me would be Shiseido ends up having a different product in Asia than we have in Europe, and then it's not good. It's not good for anybody.
I think a final question from me would be: when the DSC cells are injected into the scalp, how do they're going to populate within the scalp, but what happens to them exactly? Like, do they latch on, surround the existing follicle that's miniaturized, and then
yes, they just they travel into. So this,
do they know by
this is the niche default? They like to live in, right?
Well, they know by nature. Don't ask me why they know, but they know. And this we have shown in our annual experience when we injected, let's say, cells which were labeled green, and we found them in the cup and in the papilla of existing fibroblasts, in existing vellus hairs. So the cells know where their home is, I would say. So they are just not sitting there. If you inject them too deep, let's say somewhere in the subcutaneous fat, then nothing happens. It must be in the area where the hair root is. And that's why it is so important to inject them into all the different layers in the dermis where all those miniaturized hair follicles are, and not only in one layer. And so they know where their home is, and they travel to the papilla and the cup region. That's the mode of action.
We've seen also, haven't we, Rolf, or some data such as us, that when, in the growth stage or just before the growth stage of the hair follicle, that that these dermal sheath cup cells migrate out and then migrate back in, right? And we think that maybe during the growth stage of the hair follicle, there's a signal being sent to recruit them back in.
Sure.
Yeah?
This he knows already. So with every hair cycle, the dermal papilla disintegrates, and with it also the dermal sheath and the dermal sheath cup. And with the next signal of a new hair cycle, this also reaggregates. So there's always also in vivo, in nature, in and out movement of cells.
So we think at that stage where there's the reaggregation, there's a signal being sent out, recruiting the cells back in, pulling them, if you will.
And probably that's the reason why we probably need more than just one injection.
Because probably the cells migrate to those follicles that are sending out the recruitment signal, and when the follicles that are in the quiescent stage, when we do the injection, that doesn't happen.
So when they're injected and the cells repopulate the dermal papilla, how does do things like, for example, CD34 progenitor cells, CD200 progenitor cells, PGE2, do those come back to normal levels pre-balding state?
This nobody has looked for. So that's unknown. Yeah?
Okay.
So future trials may. When we do our trials, we will have biopsies later on. We will look to so many factors, and these will be one of those. Yeah, but today nobody can answer this.
I mean, in general terms, we think of this cell population as a motherhood population that supports the whole milieu of cells that grow hair fibers. Yeah. And so it's kind of a supporting cell population that feeds and creates dermal papillas and keratinocytes and other cells. And without that supporting role, you can inject dermal papillas like other people have done, all you want. But if they have no support, it doesn't have the effect. So we're injecting the supportive population that then supports all of these cells that contribute to hair growth.
Okay.
All right.
Perfect. I think that's it. I know you guys got to go, so I'm going to...
So